What is abnormal menstruation? Most women have a period of 4 to 7 days. The woman's period usually occurs every 28 days, but normal menstrual cycles can range from 21 days to 35 days. Menstruation usually lasts 4 to 7 days. Example of menstrual difficulties include periods that occur less than 21 days or more than 35 days apart and miss 3 or more periods in a row, and menstrual flow that is heavier or fewer than usual. Periods that last more than 7 days and periods that are accompanied by pain, cramps, nausea, or vomiting. Bleeding or spotting that occurs between menstruation, after menopause, or after sexual intercourse. Menopause is a condition which a woman's cycle stops completely. Oligomenorrhea refers to periods that rarely occur. Dysmenorrhea indicates painful periods and severe menstrual cramps. Some discomforting during the course is regular for most women. Abnormal uterine bleeding can apply to a variety of menstrual irregularities, including the heaviest menstrual flow, a period that continues for more than 7 days, or bleeding or spotting between periods, after sexual intercourse, or after menopause. Many causes can lead to abnormal periods, ranging from stress to more serious underlying medical conditions. Most birth control pills contain a mixture of estrogen and progestin hormones. Some contain only progestins. The pills prevent pregnancy by preventing the ovaries from releasing eggs. Oral contraceptive administration or disruption can affect the menstrual cycle. Uterine polyps are small, benign, non-cancerous tumors in the endometrium. Uterine fibrosis are tumors associated with the uterine wall. These tumors are usually harmless, but they can cause severe bleeding and pain during menstruation. If the fibroids are large, they can press the bladder or rectum, causing discomfort. The endometrial tissue that outlines the uterus breaks every month and flows along with the menstrual flow. Endometriosis occurs when endometrial tissue begins to grow outside the uterus. Endometriosis can cause abnormal bleeding, cramping, or pain before and during menstruation and painful intercourse. Pelvic inflammatory disease, PID, is a bacterial infection that infiltrates the female reproductive system. Bacteria can enter the vagina through sexual contact and then spread to the uterus and upper genital tract. Symptoms of the pelvic inflammatory disease include severe vaginal discharge with an unpleasant odor, irregular periods, pelvic pain and lower abdominal areas, fever, nausea, vomiting, or diarrhea. In polycystic ovary syndrome, PCOS, the ovaries produce large amounts of androgens, which are male hormones. Small fluid-filled cysts can form in the ovaries. Sometimes a woman with PCOS has irregular periods or stops menstruation altogether. Early ovarian failure occurs in women under the age of 40 whose ovaries do not function normally. Menstruation stops, just like menopause. Other causes of unusual menstruation include uterine cancer or cervical cancer medications, such as steroids or anticoagulants, blood thinners, and medical conditions, such as bleeding disorders, hyperthyroidism, hypothyroidism, or pituitary disorders that affect hormone balance and pregnancy-related complications, including miscarriage or ectopic pregnancy. Every woman has a different body, and listening to your body can help a lot.